We got here by doing things our way, the Arizona way. And I'm here to tell you, you ain't seen nothing yet.
That was the governor in January's State of the State address. It was vintage Doug Ducey. Pundits called it a victory lap. Arizona's economy booming, a huge surplus in the treasury.
The governor's supporters in the business community and on the political right at that point feeling bold and in charge. The usual swipe at California.
We launched the Happy Babies program to let new parents bring their infants to work. And how do we know it was a great idea? Because in California, it got vetoed.
But in China, COVID-19 had already been at work for 2 months. And by the end of February, Governor Ducey wasn't able to run any more victory laps.
He is now a governor dealing with an unprecedented public safety threat. Now he's part of daily news conferences facing tough questions and criticized by another prominent leader, Senator Kyrsten Sinema, for what she and others see as a slow and ineffective response.
ABC 15 reporter Nicole Grigg has been following the governor and the state health services director, Dr. Kara Christ, for weeks. She's here now with a look at how both leaders are dealing with what can sometimes seem chaotic.
They're a two-person team at the center of the COVID-19 response. Their every word and every move being analyzed by leaders, healthcare establishments, by the press, and by everyday Arizonans. They're all craving leadership.
We'll be using every tool in our toolbox. We will use every tool in the toolbox. And we are prepared to use every tool in the toolbox as necessary to protect public health.
It's a two-person show. Their words blend together. They read the same lines, nearly the same scripts. To the point, it all sounds the same.
Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting high-touch areas like your doorknobs, light switches, toilets, faucets, and phones.
Arizona had one of the first cases of coronavirus, but it took over 30 days until a press conference. And now daily briefings, simple messages repeated over and over again. And as the complexity of the problem grew, a response that felt urgent and in charge.
I'm declaring a declaration of public health emergency.
The governor declared a public health emergency 9 days ago, while most schools were on spring break. Then as parents and administrators waited for what to do next, silence until hours before kids were to go back.
We are announcing a statewide closure of all Arizona schools from Monday, March 16th through Friday, March 27th.
School was out, maybe for the year, seemingly without a plan to deal with thousands of students and parents who suddenly have no teaching, no lesson plans, no activities, no childcare. Home from school and waiting, worrying about whether they will be infected.
Can you guarantee that people in Arizona are going to be tested?
So those that are at high risk or those that are symptomatic will get tested. It will be a while before we can get the capacity to test every Arizonan that wants to be tested.
So no.
Not at this time.
We're learning widespread testing is not happening as there's a nationwide shortage of tests. Want to test in Arizona? Need tested in Arizona? Good luck.
Yeah, I was ignored by hospitals, emergency nurse lines. Anybody that I reached out to was not willing to help.
Arizona has some of the strictest criteria to test at their public state lab. They've tested 343 people, far below their promise of up to 450 a day. Arizona's top public health doctor is using outdated CDC criteria to test. The reason, she says, Arizona is relying on private labs.
High risk population, that's what we are testing. So we want to make sure we've got the capacity to test those while our commercial labs are testing the population.
Private labs that are facing nationwide shortages, private labs that send tests out of state, and private labs with turnaround times 3 to 5 days or longer, and stories coming in to find testing.
Here's where the issues start. There are no tests in Maricopa County right now. They've got a few, but those are reserved for the gravely ill. Unless you are gravely ill, you're not going to get a test.
For Governor Ducey and Dr. Chris, COVID-19 is fast moving. They're slower to act, most times behind other states instead of leading.
I'm not in competition with any other governor or place in the nation.
Daily briefings with little to no new information. The governor would suggest, not require, closures of bars and restaurants. And a day before St. Patrick's Day, partygoers had no clear direction if or where to go, as Phoenix Mayor Kate Gallego watched and waited for something, anything from the governor's office before closing bars and restaurants in the nation's 5th largest city.
Before I made my announcement, I did encourage the governor's team to make this a consistent policy across the state of Arizona. Many states have implemented these restrictions at the statewide level, and it's something that I would like to see.
Movement on closures came days later. The biggest unknown, Arizona's economy being put into what some call a coma. Arizona largely built on entertainment, tourism, on spring training, outdoor festivals, everything around the Valley of the Sun. And the fear is what's to come.
Small businesses ranging from catering companies all the way up in Payson, who have lost all of their catering contracts for the foreseeable future, to boutique hotels in Tucson that are seeing 6-figure drops in revenue overnight.
The critics not afraid to call out the governor, pressure coming in for bolder actions. U.S. Senator Kyrsten Sinema saying Governor Ducey is slow to act to stop the spread of COVID-19.
She's frustrated that the governor is not doing it from a statewide perspective. And I think she's correct. All I can say to her is when we need her the most right now, bravo, she's coming through.
It's unclear what changed the governor's mind, but just 24 hours after he said he was not activating the National Guard, he did, and he was after 20 other states did.
What about the National Guard?
If we need the National Guard, I'll call the National Guard up.
His tune changing quickly in that day turnaround. He says the National Guard will help the food banks, a place that the governor has said himself is in desperate need of help. The National Guard will also assist grocery stores at a time where people can't seem to find everyday essentials.
Our grocery store workers who are working incredibly hard to keep the shelves stocked and working around the clock to meet the demand.
Direction coming all at the governor's pace. Economic analysts say it's unknown what COVID-19 will do to Arizona's economy, but we can expect tens of thousands will be forced into unemployment and cost $1 billion in Arizona.
One of each, there you go.
And Thursday, it was a photo op moment. The governor joined a sometimes political rival state school superintendent Kathy Hoffman handing out meals at a closed school where a lot of thank yous were said.
Thank you.
Thank you to Principal Dial.
Thank you, Governor Ducey, Superintendent Hoffman, and Dr. Christ for being here at Cartwright this morning.
Watching from home in self-isolation is Glenn Hammer, head of Arizona's Chamber of Commerce. He's a powerful voice and advisor to the governor. He suggests calm, confidence in Doug Ducey's leadership.
We have the best governor in America when it comes to the economy of Arizona.
We're in a pandemic. We're teetering a recession. The very foundations of Arizona are shaking. The governor tells us not to worry. But is anyone hearing these words?
We'll continue to get through this. We are going to get through this, and we'll get through it together.
In Phoenix, Nicole Grigg, ABC 15, Arizona.